Welcome back to Medicine Deconstructed. I'm your host, Dr. Jay Rutland. In our last episode, we talked about the pathophysiology of psoriasis and how it's a systemic autoimmune disease. In this episode, we're going to talk about what Kim K can actually use to treat her psoriasis, along with the other 125 million people worldwide that have the condition. There are many options for therapies, but if you ask me, I believe psoriasis to be a systemic disease, which it is, and that's how it's defined. However, we always start with topical therapies to treat first. So if psoriasis is mild to moderate, meaning it's less than 10% of the surface area of the skin, and there's no signs of arthritis, you're going to start with topical steroids, topical retinoids, vitamin D, and calcineurin inhibitors. These are all topical creams. These medicines work by inhibiting the immune system, in the case of calcineurin inhibitors and corticosteroids, or normalizing some of the cell lines and turning down the immune system in the case of topical retinoids and vitamin D. You guys have all heard that Kim Kardashian has a tanning bed in her office at home, right? Well, it actually turns out that phototherapy or ultraviolet B radiation is effective in psoriasis. Tanning beds emit both UVA and UVB radiation, although mostly UVAs. So Kim wasn't exactly wrong when saying that tanning helps her psoriasis. UVB actually increases anti-inflammatory cytokines and shuts off the immune cells that lead to the symptoms of psoriasis. Systemic therapy includes heavier oral immunosuppressive drugs and/or biologics, cellular communication inhibitors that block certain cytokines, chemokines, or other molecules. Methotrexate, which is a PO pill, inhibits the production of NFK-beta and TNF. Acitretin is an oral retinoid which reduces Th1 and Th17 activity and normalizes keratinocytes. Cyclosporin inhibits T cell activation. Apremilast reduces TNF, interleukin 23, and increases anti-inflammatory cytokines. Then there's a class of drugs which I love, which are biologics. These are monoclonal antibodies that inhibit cytokines which activate white blood cells. Certolizumab, which is subcutaneous, and infliximab, which is IV, inhibit TNF. Ustekinumab, or Stelara, inhibits interleukin 12 and interleukin 23, and secukinumab, or Cosentyx, inhibits interleukin 17. I think of autoimmune disease as systemic, so if you're in my office, I'm likely to use a biologic in combination with a topical therapy. When it comes to interstitial lung disease and psoriasis or psoriatic arthritis, it does happen. I have several patients with psoriatic arthritis and or psoriasis that have fibrotic or inflammatory interstitial lung disease. I have to understand how certain cytokines and chemokines lead to disease so I can pick up an appropriate therapy and make sure patients feel and get better. Kim, there's treatment options for you. Trust me. We're going to see you next time on Medicine Deconstructed. Go ahead and like, subscribe, and let me know what you think and what I can discuss in the future. Take care.